Why you keeping me waiting? Be so long. Why you keeping me waiting?
Prepare to experience the strongest radio allowable by law. Secrets will be revealed. Myths dispelled. From the studio gym where excuses never apply, it's Superhuman Radio with your host, Carl Lenore. Hey, welcome back to another episode of Superhuman Radio. Let me just make sure everything is running the way it's supposed to here. Yes. Okay, great. We have a good show for you today. And some of you may say, but Carl, how much more can you talk about magnesium? A lot more. There is clinical research that shows that the majority of the population is deficient in one way or another in magnesium. And we're going to expose magnesium supplementation specifically from a healthcare standpoint. There's good research out there that explains its benefits and who should be focusing on using it. We're going to be joined by Wade Lightheart in just a moment to talk about that. Before we do that, I want to thank our title sponsor, and that's Legendary Foods, makers of the tasty pastry. Less than 1 gram of sugar, 20 grams of high-quality protein, 4 to 5 net carbs if you're a net carb person, and best of all, your kids will eat them and love you for them. shrnetwork.biz/legendary. Use the code SHR10 to save 10% off your tasty pastries today. And without further delay, get my buddy on here. I always look forward to spending one Friday a month with Wade Lightheart. How you doing? And plus, I had that beautiful picture of you and Joel Green. Where were you, in the airport in California?
We were at Expo West, if you can believe it. So yeah. It was back on after 3 years absence. So nice to be there, and it was great to connect with him. He's stopped by our booth to say hi, which was someone snapped the pic, fortunately.
Well, and Joel has been bugging me to do something, and when he sent that picture, he said, even Wade agrees. I've been doing things the same way for 16 years, which makes accessing information on my podcast difficult because I do all these standalone shows, and Joel has been bugging me to like catalog stuff, turn it into books, one book about peptides, and he said, and even Wade Lightheart agrees. When will you do this? So I am working on it. And I appreciate your belief in the show. I really do.
Funny enough, and I'm glad you brought this up. I was actually going to bring this up today. So concordantly, we were on point. We were talking about that specifically, and I want to just give a shout out before we get into the conversation, particularly about the show and your history and your understanding. And I would say that, first off, your cognitive capability is superior to most people in the industry. So that's a gift, and you've leveraged it in a really beautiful way. And this, what seems kind of ordinary or integrative on your side, is truly astounding. And I think that's why you've had such a great show for such a long time. However, so many people don't know about all of that time span that's been built up. They jump in, they listen to you for a show or two, or they're here one day or nothing. There's a body of work that's been put together that should be categorized, organized, systematized, and then brought to the public space, because there's a real gap between what science is saying and doing and what's working in the real world. And we're at a loss for critical thinkers right now between our institutional component and the politicization of information. And you're a beautiful synergist between those models, being able to look at data and say, this is really effective and this is something that we can do, or we can make some extrapolations, or we can make some correlations here. And I think that is a missing element. And it's needed for the newbies coming up. Like there's a whole field of young guys, like in their 20s and 30s that are going to be the voices, speakers in the next, 10, 15 years. And why wouldn't they want to access that library? And I'm going to connect this one last person. I'll be on Paul Check's show next week. He's a friend of mine.
Great guy. Yeah.
And he's very simple, just a total brilliant guy. And he's got a team that's categorized his information in a way, because the problem with the brain like yours, it needs to consume all the time.
Right.
And it's same as him. It's a consumption thing, and it's a conversion thing, and it's a synthesis, like a factory of information that takes raw data and processes into a synthesized, usable, digestible product. And Paul's like that, and you're very similar in how you think and how you go. And so I think it would be a great service if you do that, and I would certainly support it. And I think many of your listeners would too.
I've always wanted to have Paul on the show. So when we're done with today's show, can you connect us?
100%. I'll be happy to connect you guys.
Okay, so on to the topic at hand. Magnesium plays an amazing role in the body, and it is well understood that magnesium deficiency is possibly 3/4 of the population. So think about this for a second.
For RDA, not even talking optimized.
Yeah, right. And the RDA is just enough magnesium so you don't die, but you can live ill. For those of you who don't understand how the RDA was established, they took rodents, usually pregnant rodents, and they starved them of certain nutrients until the pregnant rodent reabsorbed the fetus. Because when a mother is building a baby, regardless of what species it is, it has to allot all of these important things for the baby to protect the baby. And if the mother's not getting that in the diet, the body abandons or aborts the baby. And so that's how they came up with 60 milligrams of vitamin C a day is all you need, because you won't get frank scurvy. And anything less than that, the mother reabsorbs the fetus. So that's it. But there was never a discussion about optimize, like this will keep you from dying, but what will make you thrive? All vitamins and minerals are treated that way, including magnesium, right?
Yes, and I can speak to that directly. Our company's called Bioptimizers for a reason. We have been on a passionate mission, literally Matt and I our whole lives, but formally within the company structure for 18 years. And we've been searching for the answer to those particular questions. We have a book called Sick to Superhuman, and we like to lean towards the superhuman side of things. And that's why we're on this podcast, right? Like, I'm not interested in average. I'm not interested in good. I'm interested in great and pushing.
And superhuman. Yeah.
Yeah. Pushing beyond possibility.
Right.
And just recently, we have a lab. We have 13 PhDs and graduate students working for us in a lab in Bosnia, where we're running tests every single week that we are funding as a company, and we are getting extraordinary breakthroughs. Now, many of us know us in the digestive health space because we really don't feed our bodies. We feed the bacteria that feeds our bodies. Adding an element like magnesium breakthrough to the mediums that probiotics are grown on had results in some categories of 1,000% improvement in function. It had some elements that were building biofilm, that weren't building biofilm, that started to make healthy biofilm. The changing of the production of antioxidants from these probiotics changed radically by adding this element. There's some other things that you can add as well, depending on the bacteria, depending on the culture, depending on the food. But one of the concordant things is when you added magnesium breakthrough, the functionality of these probiotics changed radically and dramatically. And that's what's feeding your body all these nutrients. And we're going to be releasing that information very soon. You're hearing it here first. This is a cutting edge breakthrough. It's a cutting edge breakthrough, and we are moving towards, because now we have the technology to test and actually prove in a setting. Now we get the testimonials, we get the feedback from people. Oh, my sleep's better. Oh, I have more energy. I'm sleep. Whatever the thing is. My headaches went away, but I think it's directly correlated, and part of the deficiency that's happening in the world today, if we look at specific deficiencies, is chemicalization. Let's just call it as it is. Chemicalization is chelating a lot of the vitamins and minerals that we are eating and making them unavailable to these bacteria cultures. They're making them unavailable to our bodies. So even if you're consuming the RDA or what you're supposed to get, the chances that you're getting into that body, if there's chemical agents on your food, is pretty high. And you can take some testing to see if some of those agents are present. Like Great Plains, if you're looking at Great Plains test for individual, I always love to give practical information for every product, is, start looking at your Roundup levels, as I say. That's what it is. It's Roundup. But that's a big, big, big issue.
Yes.
And no one's talking about it.
Dr. Stephanie Seneff came on this show probably 7-8 years ago when she first started to look at the research. She and, oh God, what's his name? It'll come to me in a second. They used FOIA to get over 2,000 emails from Monsanto, between Monsanto and the agencies overseeing Monsanto's release and introduction of this herbicide into the human population. And they knew it was linked to cancer back then, but more importantly, what they learned, so originally when glyphosate was introduced, they said, well, it only acts on something called the shikimate pathway, which only the microbes in the soil have.
Right.
They totally ignored the fact that microbes live in our gut, and they also have a shikimate pathway. And so what happens is glyphosate destroys your gut. Correct. It destroys your gut's ability to protect itself and to quell inflammation. And it's a horrible, horrible herbicide. People spray it in their front yards because they have a weed in their driveway, which, by the way, vinegar works, just for the record. You can kill weeds with vinegar. But the idea that there was a study that we talked about on this show probably around 2012 where Hamburg, Germany, women in Hamburg, Germany breastfeeding had breast milk tested. And keep in mind, Hamburg is a city. The rural is like hour and a half, 2 hours away. They had glyphosate in their breast milk. They were feeding these babies breast milk that already had glyphosate in it.
Yeah, and it's a crime. And I don't know how extensive the damage actually is, but I believe that at some point, this is going to be very like back in the 70s, you could smoke on planes.
Yeah, right. Yeah.
And we go, well, we don't think of nobody, but like people don't recognize, people kind of knew it was bad for you, but no one really fully grasped the extent of how bad it was. And now it's all, smoke on a plane, that's crazy. Smoke in a restaurant, that's not, like all these things that are commonplace now. And let's just say they had the best intentions. Let's just say that this was a way that would improve. Okay, let's assume that. Whether that's true or not is not the point. The point of the matter is, if you are living on the planet today, you've got to make educated decisions for you and your family, and you've got to be aware of the potential. You got to reduce our whole prefrontal cortex is a way to run experiments to save our lives.
Right.
It's just like, we run a thought experiment because do I need to do this or not? We evolved to this to make decisions on survival basis. But now the world's very complex. We're not dealing with, saber-toothed tigers, and we're not dealing with, rival tribes coming into, well, some parts of the world are. But here in North America, let's say, where most of your listeners probably are, the Western world, we're dealing with a different type of evolutionary stressors that are trying to kill you. Yes. And, if you're listening to the show, you're in the right place, because we're trying to outline the new obstacles to life relative to a highly technologically innovation. So we can get out of the good, the bad, the evilness and stuff, because you can get caught in a really negative conspiracy rut, and it's easy to fall into that trap
and become depressed and unmotivated, by the way.
Correct. But we owe it to the generations before us and the generations moving forward to make better decisions based on the threats that are present to us, and to be able to select the things that for optimal survival moving forward for the generations to come. And our decisions echo throughout time.
I want to mention one other thing, and then we're going to talk about the research on magnesium. A lot of people hear the word biofilm and they think, well, wait a minute, I thought I'm supposed to be trying to get rid of my biofilms, because that IG Instagram ad I read said, crap out your biofilms and get, just for the record, biofilms happen for a reason. For instance, a breastfeeding mother who has HIV, who breastfeeds a baby, biofilms sequester the HIV virus and keep it from getting to the baby. Biofilms are not bad. Like Joel Green likes to say, that's just baby talk. Good, bad. Biofilms are there for a reason. If you do have a lot of biofilms building up, it's because there is some bad stuff in your gut and it's trying to be sequestered. So I just wanted to put that out there about biofilms so that people don't jump on me.
Yeah, there is good biofilm and bad biofilm, though, which is kind of what Joel said is thing, but understanding the nuances. And if you just look at this is bad, that's good, but there are different types, different reasons. And this is what bacteria will create in order to ensure their survival during times where there's leanness, and then opportunities when there's type food, because we used to eat on a cyclic diet, right? A seasonal diet.
Seasons, right? Exactly. Yeah. So let's talk about magnesium. Yeah. One of the things I never realized about magnesium was it's responsible for recycling ATP. Now, let's just think about this. All of us who train, we take creatine because we want to recycle ATP faster. You can get another rep out. Well, magnesium will do that for you as well. So you probably should take magnesium before you train, because making it available in the bloodstream while you're training is probably wise. But the other thing that you have to understand about ATP is when you do work, the adenosine is cleaved and it is then recycled, okay? But the adenosine that's cleaved goes to the brain and causes something called sleep pressure. This is why when you get out in the backyard and you work for 5, 6, 7 hours, you go to sleep that night, you sleep so great. You think, oh my God, I was so exhausted. That is because of the accumulation of adenosine in the brain that causes sleep pressure. So not having enough magnesium, not being able to recycle enough ATP pretty much ensures that you're not going to feel that sleep pressure at the end of the day. So think about that.
Yeah, and actually funny you should say that, because when I went through the history of why we developed the magnesium breakthrough was because I had over-relied on stimulants and to keep me going to manage 3 businesses simultaneously, living in multiple jurisdictions around the world and time zones and things like that. And you get on a cycle and you're working and you're stimulated to stay kind of cognitively, with it. But I didn't want to sleep. Like I couldn't sleep. I'd go to sleep. I'm only sleeping 6 hours, but I'm awake.
Right.
So I experienced that. And then when we did my testing, we did my SpectraCell testing. Oh, my magnesium levels were super low. Now I'm a plant-based diet guy. I'm eating a lot of magnesium in my diet. I'm like, how is it possible that I'm not getting magnesium? Well, then we went into Charles Poliquin's work and we started looking at the different types of magnesium, and some were uptaken by the brain, some weren't, some were, so these type of things. And that's what led to the testing and research that eventually came to magnesium breakthrough.
And for those of you who don't know about magnesium breakthrough, I take it at night before bed, but I also do take it throughout the day with my meals. And it is the single best magnesium supplement in the world. And we'll talk about why that is. If this sounds like an infomercial to you, it is, because the more people I can get to use magnesium breakthrough, the more healthy people I'll have in the audience. Within the frame of a 70-kilogram individual, there's an average of 25 grams of magnesium in reserve with 53% of it being in bone, 27% of it being in muscle, 19% of it being in soft tissue, and less than 1% in serum or available in the blood. The reason this is important is because look at that downstream, the trickle down. So when there's not 1% in the serum and you're not consuming enough magnesium, then it starts to rob it from other places. And it goes upstream to soft tissue, to muscle, and then eventually bone. And once it starts robbing it from bone, that's when you start having brittle bones, osteoporosis. Oh, mom, you didn't break your hip when you fell. You broke your hip and then fell, because we're learning that this is a reality now.
Yep.
So understand that looking at the 1% found in serum is not an accurate way to assess whether or not you're getting enough magnesium in your diet. And don't you use the SpectraCell test for that? The test.
I do use the SpectraCell test for that, because, and there's another thing that you want to cross correlate that, and that's a good DNA test. And the reason being is there's a huge variance in how well you absorb and utilize the vitamins and minerals that you get. And I have a whole belief. We've got a book coming out next year on dietary selection. And I believe that the reason people do better on different diets, why there seems to be this dietary tribalism, is I think humans, number one, can, in a perfect world, can do well on a variety of different diets. That's one of the things that makes us unique, is we're extremely adaptable.
We're hybrids, right?
Yes. However, I do believe that if we look at evolutionary pressures over time, if we look at microbiome damage due to some environments, and local conditions, right? These can affect the effectiveness of any given diet on a person. So what you've inherited from your parents, which was the past, the successful passed down genes, and what is the local environmental conditions, are all going to influence your end result. So if you're looking to become superhuman, you need to have a DNA test, and you need to have your SpectraCell test. And then you have to have a good analysis, like, for example, like I talked about the Great Plains thing. Well, do I have a lot of glyphosates present in my food? How is that going to impact my microbiome? Okay, so once you understand that, you want to have the bacteria that supports your diet. You want the dietary elements that your particular chosen diet that doesn't have. Like, my needs as a vegetarian are very different than someone who is a ketogenic guy. So there's certain advantages and disadvantages of each diet, and what things do I absorb? What's my individual biological heritage? If you understand all of those components, guess what? I could probably switch over to a complete carnivore diet in the course of 6 months and thrive.
Right.
And vice versa, I could probably take someone on a carnivore diet and put it the other way, because I can use my intelligence, I can use research and science to tweak these in a way that I can extract what I need to do. If I don't do that, going to another program, I'm going to have a disaster, and it's not going to work. And we hear about these disasters. I tried this diet, it didn't work, I felt terrible. It's like, no, you didn't use your brain to make the adaptive responses so that you could extract the best out of that diet. Now, that doesn't mean preference, and preference is about lifestyle. Hey, I like this diet because this is the one that works for me. It fits my lifestyle. I work a long time, or whatever it happens to be. Great. We can get rid of bad and good. We can just get into, how do I be superhuman?
Right.
How do I get to the best thing? And so I always want to couch that before I talk about a product, because when we talk about products, I don't want to be just coming on your show and say, hey, buy my product. This is why it works. I want to give people the framework of how we come to these conclusions first, how they can apply things in their own life. And then guess what? Let's get into the product stuff, because yes, this can be a transformational product for people across the board, regardless of their dietary choices, for the reasons that we're outlined here. It's essential to living your best life.
And remember, when we talk about where magnesium resides, that's just the reservoir magnesium. There's magnesium being used every second of the day for over 300 different biological functions. And one of them should be very interesting to you, because we hear about RNA and DNA. Well, the synthesis of nucleic acid depends exclusively on the presence of magnesium. So if you're worried about, epigenetic effects and my genes and my RNA, because I'm taking these RNA vaccines now, you better believe that magnesium is what is creating the nucleic acid in all of those functions. Without magnesium, you run out of nucleic acid. You run out of nucleic acid, you have no more DNA and RNA turnover. You have no DNA and RNA turnover, you will be dead eventually. I mean, sooner than you would have been. So magnesium isn't just, this mineral, if I take too much of it, it makes me poop. It is critical to existence. And right now, according to authorities who are following this on a worldwide basis, 3/4 of the population isn't getting enough magnesium day in and day out, which means it's robbing it from your muscles, your bones, and every place else. And you can bet that your nucleic acid pools are drying up and all sorts of other horrible things. I want to go ahead and take a break. Before I do that, I want to just put this up for those of you. And then we got a couple questions we're going to answer. People are asking about the different forms. Magnesium Breakthrough truly is the single best magnesium supplement in the world. It has a multitude of forms in it, all designed to do different things, shown in science to have different effects. And right now, if you go to shrnetwork.biz/mag and use the code SHR10, you can save 10% off. And they have a money-back guarantee that if it doesn't work for you for whatever reason, you send it back. And that's all there is to it. Very few companies do this nowadays because they're afraid that people are going to be disappointed in their product. So that means you have to have a lot of trust in your product, and you have to have had a lot of success with people using your product in order to even have the courage to do something like that. If you are not taking magnesium today, you need to be, and don't waste your time with other bottles of magnesium. Go right for the MAG Breakthrough. Again, shrnetwork.biz/mag, SHR10 for the coupon code. Let's take a break. We have a couple questions. We have lots more to talk about the rudimentary value of magnesium in health. Stay tuned. We'll be right back with more Superhuman Radio. If you'd like a shortcut to better sleep, more energy, and calmer, more stable moods, then you should make sure you're supplementing with magnesium daily. Let me tell you why. About 75% of people are magnesium deficient. This deficiency can lead to higher levels of anxiety, irritability, trouble sleeping, and low energy. It can even contribute to foot and leg cramps while you sleep. Magnesium Breakthrough by Bioptimizers is the single best magnesium supplement in the world. Simply take 2 capsules before you go to bed, and you'll be amazed by the improvements in your mood and energy levels, and how much more rested you feel when you wake up. I take Magnesium Breakthrough every night, and I sleep better because I use it. Go to magbreakthrough.com/SHR and use the code SHR10 during checkout to save 10% off and get free shipping. Check it out. Plant medicine has become all the rage for mental optimization. Now there's an ancient plant medicine rapidly growing in popularity that experts believe might just be the alcohol of the future. It's called True Kava. Kava is a natural food-grade elixir that has been used for over 3,000 years by South Pacific Islanders as safe, non-addictive alternative to drugs and alcohol. By naturally boosting the brain's main feel-good chemicals, dopamine, serotonin, and GABA, Kava provides you with both increased relaxation and mental clarity at the same time. True Kava is a new form of stabilized full-spectrum traditional Kava that is third-party lab tested for quality and safety. Go to shrnetwork.biz/True Kava, and that's TRUKAVA, all one word, and use code SHR for 25% off today. Being superhuman means being conscientious about the choices we make. White Oak Pastures is superhuman when it comes to raising livestock. They're committed to animal welfare, land regeneration, and rural revival. They responsibly manage the entire process from the pasture to your doorstep. High-quality, pasture-raised, great-tasting meat from a farm you can trust. Full nose-to-tail selections. They even have options for your pet. Go to shrnetwork.biz/White Oak and use the code SUPERHUMAN to save 10% off your entire first order. Most people have heard of phytoestrogens, but did you know there are beneficial phytoandrogens? The top source of these is pine pollen. It even contains trace amounts of testosterone and DHEA. If you're looking for a 100% natural testosterone booster, this is worth trying. Lots of men love it, and it even works for women. Lost Empire Herbs offers the highest quality wild harvested, non-irradiated pine pollen backed by a 365-day money-back guarantee. It works for you, or you don't have to pay for it with nothing to send back. Go to shrnetwork.biz/Lost Empire. Use code SHR. Get 15% off your order today.
Dogs should be powered by fat and protein, not carbs. That's why Visionary Pet makes low-carb, ketogenic dog food for dogs of all breeds and life stages. From kibble to freeze-dried and even low-carb treats, all Visionary Pet recipes are very low-carb, ketogenic, and made with 100% real meat protein. Shop now and use code SHR for 20% off your first order today. Your dog deserves the lifelong benefits of optimal nutrition. Make the switch to Visionary and see why smart dogs eat low carb.
If you've listened to Superhuman Radio for any length of time, you know I'm a big proponent of peptides. One of my favorites is GHK-Cu, the blue copper peptide. It has the ability to repair and regenerate more youthful expression of skin cells, reversing the signs of aging. Restore Cell's Stem Cell Awakening Serum, along with their other products, contains potent formulations of blue copper peptides and only the highest quality organic ingredients. Superhuman Radio listeners can now save 25% site-wide. Go to shrnetwork.biz/blue and use the code SHR25. Remodel your skin today.
This is the Superhuman Channel. Evolution just got kicked up a notch.
Hey, welcome back. We're talking with Wade Lightheart. We're talking about magnesium. Let's get a couple of these questions out of the way. JG says raw cacao powder, magnesium epicatechin. But you got to eat a lot of chocolate to get the magnesium. In a piece of dark chocolate, it's about 150 milligrams of magnesium in about a 3.5 ounce piece. Now, if you're eating a Lily's sugar-free, maybe you can get by with that, but that's a pretty big hunk of chocolate for somebody to commit to eating every day. And it's only 150 milligrams. Research shows you need 400 to 600 milligrams a day to even top off reserves. Am I right about that?
You are indeed. And one of the things that I have noticed, though, is a lot of people who crave chocolate is one of the earliest signs that you are magnesium deficient. So I always try to take apart food cravings, and that I believe that they're distorted biological drivers. So when people are craving something in excess, they are trying, and you can go back to Eric Schlosser's book, Fast Food Nation.
Yeah, I remember that.
And it was in 1970s, the food industrial complex started building food replacements. In other words, chemical agents that gave you flavorings and taste. It's all down on the New Jersey Turnpike and these type of things. And what was interesting is they would mimic essential elements that you need. So your body, let's say your body wanted magnesium. It thinks it's getting magnesium from this food additive or flavoring agent, but it's not. So as you consume it, it increases your craving for that Frankenfood.
Because it's not satisfying your need. Yeah.
Correct. But your brain is registering, oh, I'm getting magnesium, but it's not getting magnesium. It's getting like fake magnesium, if you will, because it's getting a chemical creation that's mimicking, that drives increased consumption of that product. So for example, if a dog gets sick, okay, which a dog is a carnivore, essentially, but it'll eat herbs and grasses that will make its stomach better.
Right.
It's natural, intuitive nature. If you give a child that has had no exposure to chemical agents and sugar at 3 years old, and you put every type of food inside of a room, they've done these experiments, the child, the 3-year-old, will select the foods that are actually perfect for its microbiome and its nutritional needs. Right. But we've distorted that through a variety of things over the last 50 years, and we're trying to climb our way out of that hole over that. So again, we're all sugar addicts. We all got sugar as a kid. We're totally addicts on that. We're not getting off that addiction. If sugar was released today, it was like cocaine, and a lot of sugar comes with cacao. And I'm a big cacao fan. I've got 5 different friends who have cacao companies. We
Right.
love it. The ironic part is they're all using Magnesium Breakthrough, and I'm eating their chocolate. So
That is funny. That's
Yeah.
funny. So let's see here. So Kanishk Goroda is watching on YouTube and says, "Sir, which magnesium form is stored in the liver? Is there just one that's stored in I know that's true of like B12 and certain vitamins, but is there only one storage form of magnesium?"
I couldn't say yes or no. I haven't seen conclusive evidence of that information, so I'll withhold comment for the sense that I could be incorrect.
Okay. Okay, with that being said, what forms are in Mag Breakthrough?
Okay, great. So we can get into all the different forms. So first off, I will say before we start with Mag Breakthrough, dark chocolate, avocados, nuts, seeds, bananas, leafy greens, tofu, and legumes. Those are all foods that have magnesium present in them. Again, try to get them in a non-chemicalized state so that you can absorb and utilize that. We have bisglycinate is one of the elements inside that. And so that one has been really noted for vasodilation, as well as for type D2 diabetes regulation, osteoporosis, migraine headaches, again, going back to vasodilation and blood pressure lowering. That's what the evidence shows in research papers. And then also serotonin manufacture. 95% of your serotonin is made in your gut. And guess what? Remember when I was talking about some of the elements that are being created by bacteria when you add magnesium? Well, guess what? That's one of the elements, bisglycinate, which has been able to show that you can improve the serotonin production with bacteria, which is made in your gut. Really interesting. Yeah. Magnesium malate is another one. And that's one particularly when you talk about ATP recycling and stuff. Magnesium malate has been demonstrated to improve the enzymatic process. And a lot of people have found relief from things like fibromyalgia and chronic fatigue. Again, we're not making medical claims or stuff. That's what the research was showing. And I believe it's directly related to that. I don't know. I'm not a doctor or a medical researcher, but that's what people are reporting. We also have magnesium taurate. Taurate's a very interesting one. It's really, it's both it acts kind of as a nootropic like taurine, and we're big on nootropics. Again, this one gets into the brain very well with the prevention of migraine, so vasodilator again. And people who have a cognitive function, enhanced cognitive function and memory, taurate has been helped to do that. And also, it's GABA-like. We talked about,
Right.
GABA is kind of I call it the lucid kind of feel good neurotransmitter, kind of that relaxed Zen state. You get it from really good certain types of
in fact, I would argue that GABA is required for flow state, because flow state is a combination of heightened focus, but a relaxed feeling that you're capable of doing whatever it is that you're about to do in the moment. And so GABA is kind of like the brake. It's tapping the brakes all the time, so you feel calm. You're not shook up. Yeah, I agree with you.
Yeah, it's one of the things, and we do neurological research with neurofeedback states, and GABA is very interesting in its effects, and I would love to see more stuff around. If you look at high performers in stressful situations like NFL quarterbacks, if you look at like Navy SEALs, people in high risk situations, a lot of the people who are doing the kind of the flow state, flying on the squirrel suits and stuff, you're going to notice that they have a precursor for GABA uptake in the brain, and it becomes it's one of the very addictive parts of GABA, so that's interesting. Magnesium ortate's another one we have in there. So this helps maintain nerve function and muscle function. So a lot of the studies that you see around the relaxation part, vasomotor, these type of things, glucose levels, again, that's where a lot of that research, orotate, we have that in there. We have magnesium aspartate inside there as well. So you'll see that one in there. And then citrate. This is the one that draws the water into the intestines. And then a new one, sucrosomial.
Right. We actually did an entire show on sucrosomial. It's amazing with magnesium.
Yeah. So this comes out of a group out of Italy. They've got extraordinary research on how it's uptaken by the body. So you can check back to that other episode, but it's a level of absorbability is far superior than everything out there. And so we try to cover the full spectrum of different types of magnesiums, and it's been a lot of fun to do that.
So while everybody else is arguing about which form of magnesium does this and does that, they're all already in Mag Breakthrough. So why argue? Just take this and you got it covered. And Sean Wasson said something that's true of me too. He says two Mag Breakthrough and a half of a Knoll Creek gummy, which is a Delta 8 gummy, before bed, and he sleeps great. I do the same exact thing. I take 2 to 3, depending on how much caffeine I've had in the day. I'll take 2 to 3 Mag Breakthrough, and either a half or a full Delta 8. And then I combine that with 5 grams of glycine, and I take a pre-bed shot. It's 0.8 of an IU of growth hormone, about 80 IUs of oxytocin, and then 125 micrograms of GHRP6 and 125 micrograms of modified growth factor 1 through 29. And if I don't do all, when I do that, I go into deep sleep for about 2 hours, right when I fall asleep. And then I have the natural oscillations that you're supposed to see every hour and a half, but the pips are so small. I never go all the way up here to arousal where I'm almost going to wake up. It's so small, and I get the best sleep, and I've been training. I've been growing again. I feel amazing. It all starts with a good night's sleep. And Mag Breakthrough is the single best magnesium product in the world. Why wouldn't I take that before sleep?
Well, and here's another exciting thing. We're going to be releasing this data sometime later this year. We have a lab in Bosnia. I talked about that. We have 13 PhDs and master's graduates who are working around the clock doing all sorts of tests, HPLC machines, these type of things. And we've actually compared the effects of the different types of magnesium on bacteria growth, the bacteria function, the antioxidants they're producing, the nutrients that they're producing, and Magnesium Breakthrough trumps all of them. Now, of course, you're going to hear that from me. Of course, I own the company, that sort of. But here's the good news. That's why we say, hey, if this isn't the best magnesium product you've ever taken, we just give you your money back. It's really that simple. We're that confident, and we have the research to support it. It's going to be coming out very soon. I'm excited about it. We're doing breakthroughs every day. Matt, my business partner, he's a testing machine, and he gives the people in the lab coats the tasks, and they execute with phenomenal speed, and we just get so much information now that's great that we can put into our products and deliver it to the public.
Let's take this one question real quick and take a break. I have to take 3 breaks on today's show. So sure. Bob says, Amazon is now starting to require third-party COAs for supplement manufacturers. Does Wade's company have this for his products like Magnesium Breakthrough?
Yeah, we're listed on Amazon. So we've passed we've passed all of their great distribution company, but not the easiest company to deal with and to pass the sniff test. And of course, you're dealing with a lot of AI and stuff. So there's no finagling with Amazon.
Yeah. And you know what? I got to believe as a quality supplement manufacturer, that has to make you feel good, because we've been waiting for decades for the industry to police itself, but it never happened. So having Amazon kind of be a gatekeeper to say, yeah, if you don't do all the things you need to do to make the customer feel confident, then you're not going to get on Amazon. That's got to make you feel good.
Yeah, there's positives and negatives, because ultimately they also now serve as a governing body. And as a private corporation, that could run into problems down the road. And some of their policies, I hope, get updated just in regards to feedback and things like that, because there's always people that will abuse the system and create negative problems. So you have to be mindful of that. So like everything, I think it's a step up. There could be some challenges. We'll see how it shakes out over the next 20 years.
We're going to take a break. We have a couple more questions, and we have some other things we want to talk about. Stay tuned. We'll be right back. Remember those rectangular toaster pastries you used to love when you were a kid? Well, Legendary Foods has just made them better. The new cake-style tasty pastry is like nothing you've ever had before. With 20 grams of high-quality protein and less than 1 gram of sugar, you'll feel like you're cheating, but you're not. Go to shrnetwork.biz/legendary and use the code SHR10 to save 10% off your purchase of tasty pastries. Now available in cookies and cream, red velvet cake, birthday cake, blueberry, strawberry, brown sugar cinnamon, and hot fudge sundae. Go to shrnetwork.biz/legendary and use code SHR10 today. Have you been struggling to achieve results in the gym? Trouble sleeping through the night? Overwhelmed with stress or anxiety? Look no further than Infiniwell supplements. They have designed products to address specific needs like muscle growth, hormone balance, sleep, and anxiety from the first use. Infiniwell helps you live well. Go to shrnetwork.biz/bewell. That's BEWELL. And use code SHR20 and start living well today. If you've listened to this show for any length of time, you know that I have struggled to give up coffee for years. Coffee has destroyed my gut and it's impaired my health. Well, I haven't had coffee in months thanks to a product called Magic Mind. Magic Mind is the first nootropic blend I actually feel working. One shot and I'm good all day long. My memory is crystal clear and I'm able to function and have great focus without coffee or caffeine for that matter. If you want to try a product that really works, if you're like me and you want to give up coffee forever, or you just need something occasionally that will help you lift the brain fog, Magic Mind is your product. I promise you that this product you will feel when you use it. Go to shrnetwork.biz/Magic Mind, all one word, and use the code SHR for a whopping 20% off your first order. More than 240 million Americans take supplements daily in pill form, but poor nutrient absorption means the promised results are rarely achieved. Healthy Cell uses a clinically proven patent-pending gel delivery system that increases absorption by 165% over pill form. Go to shrnetwork.biz/healthycell. That's HEALTHYCELL today and use the code SHR to save 20% off your purchase of Healthy Cell supplements. I would easily say that I am the hugest proponent you will ever meet to doing anything that will improve the quality of my sleep. And that's because sleep is linked to just about every metabolic disorder we see in our population today. One of the easiest things you can do to improve the quality of your sleep is to get a pillow that can be shaped into the exact form factor that allows you to get your best night's sleep. And that is MyPillow. I've been sleeping with MyPillow for a few years now, and I can tell you that when I have to travel and stay in hotels, I don't get a good night's sleep because I don't have MyPillow with me. Right now, you can save up to 60% off of everything offered to improve the quality of your sleep at shrnetwork.biz/MyPillow when you use the code SHR. Or you can call toll-free 800-889-4938. And remember to use code SHR to save up to 60% off of everything at their website. Are you 35 or older? Every year after puberty, your growth hormone decreases sometimes by 50% by the age of 35. And it only keeps going down from there. This affects everything from making it harder to recover from workouts, sleep, and a general loss of a sense of well-being. It also affects your ability to get and stay lean. BioPro Plus is the first of its kind, 100% non-synthetic alternative to prescription synthetic growth hormone treatments. All the benefits without any of the needles or side effects and 100% safe. Previously only available through doctors, you can go to shrnetwork.biz/biopro, that's BIOPRO, and use code SHR30 for $30 off today.
This is the Superhuman Channel, where brawn and brains finally meet.
Welcome back. Just one other comment, and then we're going to go back to the list. Bob is asking for reassurances. So does Wade have third-party COA? Yes, he has third-party COA that he has to submit to Amazon in order to be able to sell on Amazon. Now, that doesn't mean that none of these manufacturers are putting all their third-party COAs out there for the world, but in order to sell on Amazon, you have to provide that proof of that. Did I explain that properly?
Correct, you did. And quick interjection, though, I have to say this. You know, I've been on this podcast a lot, and I tried the legendary toaster pastry because I had it so much. I got the chocolate one because it reminded me when I was a kid. It's really good.
I mean, I'm telling you, I have people that message me and they say the worst thing I ever did was bring those home because now my kids want them all the time.
I gotta say, I get it. I looked at it. I kept seeing it. And I was like, oh, you know what? Maybe I'll try one of those. Right? I didn't. I'm like, oh my god, those are good. So
they're amazingly good. And Ron Penna is the genius behind the Quest bar. I mean, his wife created the Quest bar, but he perfected it and made it taste so ridiculously good that people just wanted to eat them one after another. When it comes to flavors, I've never met anybody who understands, like, some sugars feel cool to the tongue. Like all this technical stuff that he understands about flavor. And we just eat them and go, man, this tastes amazing. But to him, there's a whole science behind it.
There is a science, and excellence always gets very, very deep into the granulars that is so good you don't notice how good it is. That's what the hallmark of excellence. It just seems, of course.
Yeah. All right, so real quick, let's get this one out of the way, and then we'll go back to the topic. Taylor C. says recently he heard from an Ayurvedic practitioner that if a person is in parasympathetic dominance, supplementing with magnesium could contribute to their fatigue and depression. They didn't speak to which type of magnesium. Is there any contraindication for magnesium supplementation that you know of?
I'm not an Ayurvedic practitioner, so I can't comment specifically, although I'm familiar with it. Now, I will tell you a funny story that I think is important. First off, try it. And if it goes the wrong way, we just give you your money back. That's the easiest way. Just do a test. Like sometimes we get too much in our head, but I was in India a couple of years ago attending a conference, and there was all these Ayurvedic practitioners across the board. And I was sitting next to a traditional Ayurvedic farmer, and everybody on the board is fat, really fat, like obese. And they're talking about the principles of Ayurvedic. And I'm a big fan of Ayurvedic medicine and philosophy. I really like it, right? It's very interesting. And I said to him, and he says, yeah, they don't like me much. And I'm like, why is that? He says, because they're not practicing Ayurvedic. And I'm like, what do you mean? They're all talking about it. He goes, no. He says, if you actually read the text of Ayurvedic medicine, it talks about how deep the roots need to be in the ground. The roots need to be 6 feet in the ground. All the growing things that they're doing now is only 3 feet in the ground. They don't get the nutrients. And they're not planted in the seasonal times that was assessed by the astrological positioning of the planet. He goes, they're emitting 2/3 of the Ayurvedic practitioner and advocating things, he said, that couldn't possibly solve the problem in the first place. So he says, you have a fundamental problem. And every time I go tell them about it, they get mad at me. And I laughed. It was kind of
that is a funny story, but it just goes.
But it's an important element.
Yeah.
Because at the end of the day, we have so altered our food production system and our microbiome that delivers the nutrients in the system. Many of the ancient models or many of the food tribalistic kind of mentalities and approaches to things are not really sussed out into your individual self. And if you are going to read your best self, you got to be like me and Carl and everybody that we know in the industry. You got to do self-experimentation with medical or like naturopathic practitioners that can provide you the test, the research, so that you can see the results in yourself and start doing through critical thinking in the process of elimination and addressing specific needs in a systematic way. It's the only way to get to superhuman. Anything else would be blowing smoke up your butt.
And if you are a subscriber to individualized medicine, but not individualized nutrition and individualized supplementation, why do you even care about individualized medicine? Everything's individual. Just because we're all humans, we're not the same. We have different polymorphisms. We were exposed as young children to things that change the diversity of our microbiome. So what works for me will never work for you. Maybe work 80%, but that 20% is the sweet spot where the magic is, where you live healthy for a long, long time. And you are responsible for figuring that 20% out.
Correct.
So let's go to this real quick. I wanted to go through this.
Yep.
Magnesium. Let me go up one. So magnesium has been implicated. Magnesium deficiency has been implicated in migraine headaches, metabolic syndrome, diabetes, hyperlipidemia, asthma, premenstrual syndrome, preeclampsia in women, which can kill a baby, and various cardiac arrhythmias. If you have any of those, and your doctor wants to put you on pharmaceutical drugs, work with your doctor. Get yourself a bottle of Mag Breakthrough, start taking it, and see what happens to those. Give it time, because it takes time for this stuff to show up in store. Magnesium may also be considered for prevention of renal calculi, which is calcification of the pathways in the kidneys, and cataract formation. You know how many people have cataracts? Nobody ever told them, supplement with magnesium. It may stop the progression.
Dr. Sanjay Gupta, not the one on CNN, the cardiac doctor who is in the UK, advocates for magnesium supplementation for his heart patients. And he said over 25% of them have experienced results that they didn't need their medications by supplementing with magnesium. And he's a vascular surgeon. He's a cardiac surgeon. He goes, I don't want to give you surgery. I can give you magnesium. It's done.
Dr. Steven Sinatra wrote a book in 2008 called the Sinatra Protocol.
Yes.
He is a traditional cardiac surgeon. He cracks people's chests open. He does bypasses. He does heart valve. So he had so many people on the waiting list for heart transplant, valve transplant. And so he had some work done by a group that he worked with, and he determined that if you give a person who has congestive heart failure 400 to 800 milligrams of magnesium a day, 5 to 20 grams of D-ribose, a form of sugar exclusively used by the heart, ubiquinol, CoQ10, but the active form, and N-acetylcarnitine. Acetyl L-carnitine, that in 3 months, their congestive heart failure went away. Yeah. He saw this happen to so many thousands of people. He enlisted other cardiologists that he worked with. They did it. They did this kind of like N equals many study where they were like, we have to take this guy off the list. He doesn't need a heart transplant anymore. I mean, think about that for a second. Think about that. If you have congestive heart failure and you could take 4 supplements and rid yourself of congestive heart failure, A, number one, why isn't your doctor telling you about it? And B, number two, how valuable are these minerals in the first place that you've been ignoring them for your entire life?
It's the sparks of life. Minerals are the sparks of life. You need enzymes to get your amino acids, aminos to get your minerals, minerals to get your vitamins. That's the metabolic process inside the body. And if you disrupt an element like magnesium, which is integrated in over 300 enzymatic functions, there are vast array of processes in your body that you have to go to secondary or tertiary or non-functionality. And as we age, those are going to become more and more disruptive to the quality of our lives.
Yeah, it's really staggering. It really is. And keep in mind that when's the last time your doctor talked to you about your magnesium levels? And when's the last time your doctor said to you, you know, we really can't tell a whole lot from blood, so you probably should have a SpectraCell test. Let's see what your real cellular magnesium levels are, because a lot of the things you have, type 2 diabetes and migraines, there's a reason to look at you. Doctors never talk about that stuff. They never, ever, ever. Oh, but they'll put you on a statin drug because your cholesterol's a little high. And it's folks, if you are not your own advocate, you will die a lot younger. We have to, I have to run a third break on today's show, so stay with us, and we have 2 more things to talk about. Stay with us. We'll be right back. You may be wondering why you're experiencing performance issues in the bedroom, but you're not alone. Over 30 million men experience a form of erectile dysfunction, and to many, it can feel defeating. Maybe you've tried pills, diets, exercise, but finally there's a proven solution. Meet Eddie, a discreet device designed to help men strengthen and maintain their erections. Pills can be costly and result in debilitating side effects, so I checked out Eddie by Giddy at shrnetwork.biz/Eddie and found out that over 95% of men experience positive results wearing Eddie, according to a 2021 clinical trial. This product simply works and is easy to use. Sign up for a subscription at shrnetwork.biz/Eddie and save $20 on your first device with promo code SUPER20. With free device resizes and 60-day guarantee, you'll be glad you tried it. Treat ED with Eddie at shrnetwork.biz/Eddie. That's EDDIE. C60, also known as Buckminster fullerene, is the most powerful, most versatile antioxidant in the world. It's been shown in studies to double the lifespan of rodents. We all know the importance of taking antioxidants to slow aging, reduce inflammation, and improve mitochondrial function and energy production. But there are literally hundreds of antioxidants that would cost you thousands of dollars to take every day. I take one. I take C60 from C360 Health. Revive and Rejuvenate are two blends that harness the power of C60. Don't waste another minute. Go to shrnetwork.biz/revive and use the code SHR for 15% off and free shipping inside the United States today. If you'd like a shortcut to better sleep, more energy, and calmer, more stable moods, then you should make sure you're supplementing with magnesium daily. Let me tell you why. About 75% of people are magnesium deficient. This deficiency can lead to higher levels of anxiety, irritability, trouble sleeping, and low energy. It can even contribute to foot and leg cramps while you sleep. Magnesium Breakthrough by Bioptimizers is the single best magnesium supplement in the world. Simply take 2 capsules before you go to bed, and you'll be amazed by the improvements in your mood and energy levels and how much more rested you feel when you wake up. I take Magnesium Breakthrough every night, and I sleep better because I use it. Go to magbreakthrough.com/SHR and use the code SHR10 during checkout to save 10% off and get free shipping. Check it out.
New Mass Pro Synthogen X2 just upped its own legendary game. To distance itself even further from the rest of the pack, Synthogen X2 now has double the key active ingredients. If you've ever wondered what steroid-like recovery feels like, Synthogen X2 delivers. See why others compare it favorably to powerful bodybuilding drugs at synthogen.com. Mass Pro Synthogen. When you train with it, you'll gain with it.
Spit that out right now. This is the Superhuman Channel.
Okay, we're going to move fast because I know Wade has places to be. So real quick, I want to put this one group of banners up that talk about all the different things magnesium is responsible for. It's necessary for protein synthesis, muscle contraction, nerve function, blood glucose control, hormone receptor binding. Think about that one for a second. Blood pressure regulation, which we've kind of discussed these, but also cardiac excitability. People who end up with tachycardia, a lot of times they're just magnesium deficient. Transmembrane ion flux, so through gradients, sodium, potassium, and other things moving back and forth. A gating of calcium channels, which is another thing that can cause cardiac excitability. Magnesium is involved in energy production. It's crucial for ATP production and oxidative phosphorylation, glycolysis, nucleic acid synthesis. This is your RNA, DNA, and synthesis of RNA and DNA. It is more important to you than you think it is, but you've never been told that before. So doesn't it pay to make sure that you have enough magnesium in your body? Because keep in mind, you can't OD on it. You can't take too much because your kidneys will allow you to just release and urinate out any excess. So go ahead and top it off. What do you think?
You know, you'll feel the difference when you take it. That's the biggest thing. People notice a noticeable feeling, and the variance on it, because I read every testimonial that comes into the company, everyone. I live for the testimonials. I do, right? I really do.
All right,
because our whole goal at the company is we want to help make the world a better place by helping people go from sick to superhuman. That's our mission. That's our model. That's what gets me up in the morning.
Right.
And we read those testimonials every Monday. And I get testimonials every single Monday from people from all over the world. PMS, my heart works better. I sleep better. I don't have muscle spasms. This is the best supplement. I can go to the bathroom properly now. All kinds of things like that. It blows my mind. It blows my mind that one simple mineral can make such a difference. And we've got all of the components that you can get. You don't have to get into the mental math of figuring out which one is best. We have a great program of how to take it, how to dose up in a systematic way, that using the orthomolecular nutrition protocols. And then from that, then you taper off to your dosage level that's right for your lifestyle once you've gone through that phase. And that's it. You forget about it after that. And you feel great. And that's a beautiful thing.
We had a girl on a previous show that when we talked about magnesium who said that she delivered a baby, went right into postpartum depression for a very long time. She started taking Magnesium Breakthrough. She commended the show. She says, this stuff is the greatest. I started taking this. My depression went away. True story. And here's a good tip. Craig Hollander says people with IBD, I'm assuming irritable bowel disorder, need a higher dosage of magnesium due to malabsorption issues. That's another thing. If you're somebody who's had the gastric bypass, you may need more magnesium because you're not absorbing it. There's a lot of people that suffer from malabsorption.
Yeah, and if you are suffering from that, make sure that you or had any of those conditions, really get down on your probiotic levels as well. That's going to make a big difference in correlation with your diet. So you have the right bacteria in there to help you absorb your food and your minerals such as magnesium.
All right, one last time, go to shrnetwork.biz/MAG. MAG, use the code SHR10, save 10% off the world's best magnesium product. I kid you not when I say that with all humility. And if you're not taking magnesium, you should be, because there's a good chance that you are deficient and it's going to rob it from other areas of body. Okay, that's it. Wade, thanks for being patient. We went a little long today.
That's all right. Thanks, Carl. Love it. Take care. And
have a good weekend. All right, we'll see everybody Monday with more Superhuman Radio. Don't forget, share the show. You never know whose life you're going to change when you share the show. See you Monday.